Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I'm so glad you joined us this evening. I have the privilege of hosting the program, and if you're one of our regulars, you know how it goes. We're live here in the studio, and we love when people call us, or now you can text us with any questions for our guests. We're doing a topic tonight that I've been doing this show for 18 years, and I don't think we've ever done this topic that I can remember, but it's midwifery. Midwives. We have two certified nurse midwives with us today, and I think you'll be pretty fascinated by some of the information they want to share with you. Maybe you have a relative who's having a baby, or a granddaughter, or a daughter. Just might be something you want to let them know about if they're not watching tonight. So let me just quickly, before I introduce you to our wonderful guests, I want to tell you how you can ask a question. So we have the phone number up at the bottom of the screen. We'll keep that there throughout the program. It's 969-2720. You can call toll free if you're outside of Fort Wayne. Just put an 866 in front of there, and you call in. You talk to a very nice call screener. They do not just throw you on the air. You have the option of asking your question live. I got to tell you, that's my preference because our guests can interact with you on the phone line, so maybe they need more information from you to give you a better idea or a better answer. So that's one option. Or if you prefer to just let the call screener know what your question is, that's fine too, and then we'll ask for you. The other method is new. We just started that this past winter, and that's texting. So that's a little different number, though. It's close, but a little different. 969-2730. Go ahead and give us, if you want to give us your first name, and if you feel comfortable telling us where you're calling from, that's great. Your phone number remains private, so that is not going to show up on the screen. And then just text us what your question is. So that's a nice, easy way to get your question answered as well. So let's go ahead and introduce you to our guests. So sitting right next to me on my right is Allison Thorpe, and next to her is Kate Confer, and you are both certified nurse midwives.
Yes. Yes. Thanks for having us.
I told them our first question is, I wanted them to explain what is a midwife, because I think a lot of us have heard of it. We probably think of, like I grew up watching the Waltons and Little House on the Prairie, and I think about all those little babies. Some lady just showed up and had like a little basket, and ta-da, they just kind of did their thing. But that's not, it really is a profession, and you have to be licensed, and it's overseen by a physician. Yeah. So I don't know if you guys want to address that off the bat.
Yeah, your thought is so common. I think even women who see us or come to a midwife don't know what a midwife is.
Right.
So in the state of Indiana, there's actually 4 types of licensed midwives. There's certified nurse midwives, certified professional midwives, and direct entry midwives. Okay. So those are licensed midwives who have different educational backgrounds, different scopes of practice, and then different pathways to licensure as well. And then unlicensed midwives would just be like a lay midwife, and that's the midwife you're thinking of.
Yeah,
originally,
from a long time ago. Yeah,
exactly.
But now everyone in Indiana, you said they do require you to be licensed?
Yes, if you're going to practice like in conjunction with oversight from a physician, you are licensed. And like I said, those 4 different types of midwives, they do have different educational backgrounds and different types of licensure with different scopes of practice. So, and that also kind of dictates where they can practice. Okay. So, for instance, a certified nurse midwife could practice in a home birth setting. Okay.
And also, you said some of them can even do the prenatal care in the home. Like the patient wouldn't necessarily go to an office. Okay.
They can practice in a birth center setting, and then also in the hospital. And in the state of Indiana, they're the only midwife who can practice in a hospital.
And what would you say to somebody like, do you feel like maybe it provides a more personal experience, because having a baby is so personal. Sometimes, when you're in a hospital setting, it can feel impersonal. Sure. Is that what patients tell you, like when they come to you, like why do people go to midwives instead of just a traditional like OBGYN?
Sure. Yeah, absolutely. Midwives emphasize personalized care, that it focuses on a shared decision-making model. So definitely involving the patient in all of their care is essential to providing good continuity of care with our patient. We provide all aspects of their care as well.
Okay.
A lot of people think, when they think of midwife, as just pregnancy care,
Yeah.
labor and delivery, delivering babies. We actually provide care throughout a woman's journey. So from adolescence all the way through menopause. So we take care of
almost like gynecological.
we do all of it.
Okay.
So we provide care, from contraceptive care, throughout pregnancy, through menopause, woman care. We do all of that. It's all encompassing. So midwife means with women, and we are with women throughout all of those life-changing events. So we do all of that. And a big part of what we do is labor and delivery and pregnancy care, but that's not everything.
Well, and I just, after doing some research, I thought, gosh, people should do their homework, though, because you do have a lot of different choices, but also you want to make sure you're getting somebody who is doing it properly, and there had been, I don't remember this from when I was a reporter, but I guess years ago, there had been a couple of women arrested in a different county. It was outside of Allen County, and because they weren't properly licensed, and there were some complications with a delivery, and so. The article that I was reading said, do your homework, because you want to make sure you're getting somebody who's properly licensed and, can provide the good care that you need.
Yeah, absolutely. I think if you're, seeking prenatal care or health care from a provider, it's always important to ask their credentials and their educational background.
Sure. All right, I just want to remind everybody, we're going to keep talking about midwifery here with Allison and Kate, but we would love to have your calls. So again, that's why the phone number is up at the bottom of the screen. It's 969-2720, and I don't want to forget to tell you about texting, because that's really nice and easy, and especially if you're shy and you don't want to talk on the phone or anything, I understand. So that number is a little different, though, 969-2730. And the time goes quickly. Before you know it, they'll hold up a card and tell me we have 2 minutes left. So we'd hate to miss your question. Feel free to interrupt us at any time. We'd love to hear from you. I think now today, the big thing is, the ultrasound and some of the high-tech equipment. Can people still have access to that if they go the midwife route? And I feel like everybody wants to know their baby's sex. I don't like that personally. I never found out with any of my children, and people started getting angry at us because they wanted to know. But that's a big thing. Like, I feel like if the people are really into some of the technology.
Yeah. I agree. Surprise babies are the best.
Well, it's just kind of cool that the only one who knows is God and the ultrasound technician. Right. So
makes the delivery room super fun.
I think so. Yeah.
With routine prenatal care with a certified nurse midwife, patients are going to get all of the same prenatal care they would with an OBGYN provider. They're going to get the same prenatal blood work, ultrasounds, all of that will be the same. So they will get all the same screenings, anatomy, ultrasounds, and the same availability to any prenatal genetic screening, which can give them the gender of the baby as well as ultrasound can as well. So a lot of patients are interested in the early genetic screening that can give them the gender. That is available with midwifery care, just as it is with OBGYN care. Speaking of that, one thing, we were talking about with genetic counseling is like preconception counseling as well, and encompassing some of the genetic testing that's available for that as well.
So even before you have the baby,
you can prepare for that.
Right.
Mm-hmm. Yeah, I think people, like you said, I think and I was just as guilty of this as anyone else. I just had the preconceived notion that it was just very simplistic, and didn't realize how well licensed and overseen the profession is of midwifery. So.
Yeah, I think you'll find that a lot of midwives are still going to provide evidence-based care, but are going to come alongside a woman in a way that they're going to provide a lot of education, provide more holistic care, and take the family as a whole, and like help the woman and the family help meet their goals for their pregnancy, their labor and delivery, while helping keep them and their baby safe.
Yeah. And have you ever done a home delivery? I was just wondering if, in your experience, if you've ever done that.
Not in my personal experience, I have not.
I just was wondering.
I have not either. No.
And some people are, I personally never wanted to go that route.
Right.
And I kind of look forward to being in the hospital a couple days and eating in bed. It was the only time I've ever eaten in bed in my life.
Right.
But sometimes, especially after you've had some children, it's kind of like you want a little bit of a break.
Right.
So I can understand that.
Yeah. I practice in a hospital setting. Kate practices in a hospital setting. There are some certified nurse midwives in our area that do practice in birth centers and do home births as well. But the majority of certified nurse midwives around the country do practice in the hospital setting. Even though we practice in the hospital setting, a central part of what we do is providing low intervention options for labor and pain management, including things like nitrous oxide, hydrotherapy, water birth, things like that, which is a lot of what women want for labor and delivery options. So those are all things that a lot of what midwifery care encompasses as well.
Fun. All right. I want to remind everybody, we only, time is going by quickly. So go ahead and call us, text us. We'd love to hear from you. We're going to keep talking about their profession and different options that they can provide, but feel free to interrupt us at any time. So I was telling you before that my first introduction to the field of midwifery was, I was a brand new reporter, 30 some years ago, right out of college, and we were doing a week-long series about women's health, different aspects of women's health, and I got assigned a whole thing on midwifery, and that was really my first introduction to it. I had not really heard about it before then, so I feel like it's relatively new, but do you feel like it's grown over the years, and what do you see for its future?
Yeah, I just even in my experience in women's health since I graduated from nursing school in 2012, I feel like just in this area, midwifery care has grown so much, which makes me so excited for women's health care. I don't think there can be enough midwives, so I hope to see the practice continue to grow and grow, and that we can continue to reach more women.
And I read an article that actually kind of what helped to increase the popularity of midwifery was just a shortage of physicians in the OBGYN field, which it is hard. I mean, when I just from my pregnancies, it was, it was hard sometimes getting appointments. You have to have them, but they're not always at the ideal times or anything for you, and you kind of had to take what you could get. And then now I think it's set up so differently, I would go see my doctor in the office, but then he was the one who would deliver the baby in the hospital. And now it's a different staff. It's like a hospital staff that takes care of the deliveries, and then you go see your doctor in the office, which I know for a lot of people that's kind of a turnoff. They feel like they're delivering a baby with somebody that maybe they're just meeting for the first time, impersonal. So
a lot of practices are set up quite differently. I think in some practices you may have kind of tandem care with advanced practice providers like a nurse practitioner or a midwife, and then also see a physician throughout your for well woman care or even during a pregnancy. So lots of different practices in the nation are doing a lot of shared care models like that.
Sure.
Yeah. There have been a shortage of OBGYN physicians across the country. Midwives have provided definitely a gap to providing care to women because of that shortage. And it's definitely a great model that have helped a lot of women. Midwives provide, a great access to women with low risk, healthy pregnancies,
Yeah.
and can provide that care with collaboration with physicians as needed for complications that arise. So it's a great model that works really well.
I'm glad you mentioned the complication, because I think that I remember when I was putting that special together, I thought, gosh, what if something, because things can go awry,
Exactly.
by no one's fault. It's a miracle that there are so many babies born, free of complications. When you think about all the things that, big and small, that can go wrong. So there is, but you have backup, especially I would
Right.
assume in a hospital setting.
Yeah, so there are lots of low-risk women and low-risk pregnancies, but we do understand that not every woman is low risk, and complications can arise throughout pregnancy, labor, and delivery.
Yeah.
So midwives are experts in normal, right?
Yeah.
But we are also experts in recognizing risk factors, and then also complications, and knowing when to consult or collaborate with our collaborating physicians that we may have either in like an office setting or in a nearby hospital setting, if at home, or in a birth center, or if practicing in the hospital in conjunction, just right down the hall, right? Midwives typically will have like a collaborative physician that they have that they can call if needed in those situations, yeah.
I didn't want to interrupt you, but I did want to say
course.
we do have a call. Our first
Yay.
one. Let's have more. Let's have more. Why stop with just one?
Perfect.
So somebody called and wanted us to ask for them. It was James, and he was wondering if midwifery is used more with single moms. I don't know.
I don't think necessarily more with single mothers. I would say our practice encompasses all mothers. We take care of a diverse population. Definitely we provide care to single mothers as well.
Yeah.
But I definitely feel like
I can see how maybe single mothers may want to seek out maybe a little more support from somebody like a
Sure.
midwife.
Okay.
Sure.
But
Okay.
also, a midwife is going to provide support in other ways to all mothers, whether if they, have needs for some community resources
Yeah.
and things. We are going to provide like medical care, emotional support, and things like that. But we're also just one person, right? So
Yeah.
we also know when to use our community resources when available, and help gather those people to help support our mamas when needed.
And it's interesting too. There's probably some of a social stigma that we're probably still trying to overcome with midwifery, because it's different, and it's not been around, at least mainstream. I don't, like I said, this was
Sure.
30 some years ago, was like the first time I had ever heard of it. So
Right.
do you think it's going to continue to become more popular? I mean, do you see like the OBGYN shortage continuing? Because I mean, there's, there are only so many physicians and there's so many patients, I feel like.
I think so, and I think also in practices where midwives may be in more of a hospital setting, patients may just be placed with a midwife for a first appointment, and so
Sure.
they don't, like Allison said, may not really have that, or maybe you said it, may not have that option.
Yeah.
They're just placed with an advanced practice provider instead of a physician because of no availability. But then they meet that provider and kind of stick with them.
And I think a lot of our patients have told us, throughout the years that, they didn't know about midwives, but once
Yeah.
they came and learned more about us and that the experiences that they've had with the care that they have received, they were overjoyed, and they really liked the model that we had with midwives in general, and how midwifery care was set up, and the philosophies behind midwifery care, and the options for pain management
Yeah.
and things like that. And they just like the whole philosophy behind it, so that they would seek out midwifery care again. And so
Yeah.
we've even, had patients that have moved to other states and asked, how do I find a midwife where I'm moving? And so,
sure.
Patients that had never heard of midwives want to know how to keep finding them in other places. So I do feel like midwives will continue to grow in popularity, not just based on need, but based on, patients' desire for also low intervention options, to support healthy physiological birth.
All right.
Yeah.
Well, we did get a text from somebody, so I wanted to read that question to you guys. Jasmine from Fort Wayne, thank you so much for taking advantage of our new texting option. She was wondering what the difference is. It's funny because we were talking about this before the show. The difference between a midwife and a doula.
Okay.
I love this question because Allison and I were discussing it as well.
Yeah.
So there is a difference between a midwife and a doula, and I think Jasmine also said, can I have one or the other, or do I need both?
Yeah.
There are huge differences between a midwife and a doula. So a midwife, how I talked about a midwife has, licensure, education. Yeah. A doula is there for mostly just emotional, physical, and labor support. They typically do not require an education. They can get a certification, but don't need like a license or anything. They're not going to deliver a baby. They don't prescribe medications. They don't provide prenatal care. They may help provide some education, but they're just more for support for the mom and the family. Whereas your midwife is your obstetrical provider.
Yeah.
Yeah.
Yeah, medical care.
Yeah.
So.
Doulas are really good with helping moms cope with the discomforts of labor.
Okay.
Helping with positioning of babies. They're really good at knowing like how to move mamas to help babies descend in the pelvis.
Oh,
So
okay.
they learned good techniques through their training with that kind of thing. So they're really good with position changes, massage, breathing techniques, comfort measures, those kind of things. Midwives are great with those things too. Can we always be there 100% of the time with mamas as they labor? We try as much as we can.
Sure.
Can't always be there 100% of the time.
Right.
That's where a doula can really be of great value. So I always tell my patients, definitely a doula is a great support person to have when you're in labor, especially because your midwife might not be able to be there 100% of the time. And that's something to discuss with your midwife. Are they going to be able to be there with you as
Sure.
much as you would like them to be? And if not, should you consider getting a doula? A doula is a great resource, especially if you want a low intervention, unmedicated birth. That is a great resource.
Right, and I
Yeah.
think even consider the setting where you're delivering. You may not
they
need a
so
doula.
they could be in the hospital or at home?
Yeah.
Okay.
Yeah. Consider the setting where you're delivering. If you're delivering at home, you may not necessarily need a doula as much because your midwife may be more consistently present.
Okay. Yeah, I
Right.
didn't think about that.
So.
Yeah, I've heard of that, and I saw a comedy about a really mean doula, and it was just she was mean to the husband, like she was ordering him around and telling him he was slacking off and everything, and he was afraid of her.
Yeah,
So,
sure.
but I'm sure there are lots of nice doulas out there, though.
Yeah.
So. Sadly, we only have about a minute left, so I don't
wow,
know
my
if there's
goodness.
anything else you would want to say, because also I think there may be an issue, like somebody may say, oh, my daughter wants a midwife, I'm not sure, I'm a little nervous about it. It sounds like you guys are open to talking to the family members too, or trying to
yeah.
reassure them, because it's a newer concept maybe for them.
I would say, first and foremost, know that we are highly educated. Certified nurse midwives are highly educated. We're licensed. We're backed by physicians. We know our boundaries, and we use our resources effectively. If you have any questions, definitely, seek out midwives, schedule a meet and greet appointment or a discussion to talk it out. Talk about a preconception visit to
Sure.
discuss any, problems underlying health conditions, those are great things to seek out and talk about ahead of time and see if a midwife might be right up your alley.
All right, definitely things to take into consideration. So thank you so much, Catherine, Allison, Kate, excuse me, Kate,
Yeah, it's okay.
Kate and Allison. Thank you so much for your time tonight. And thank you to all of you for tuning in tonight and for the questions. Loved it. Have a great night. We'll see you back here next Tuesday. Take care. Bye-bye.
The preceding program on PBS Fort Wayne is made possible in part by...
You gotta find your people,
Good morning.
the ones that make you feel whole.
How you feeling?
You look so pretty today.
Bring it together, you got nothing to lose.
Good job.
In a world full of strangers, you don't know who to trust. You can't go it alone. Everybody needs help.
Go.
You gotta find your people, then you'll find yourself.